This is the book Beat Depression from 2001 by David Hinds. This is chapter 28, Depression Requiring Specialist Intervention. I do not know whether I was then a man dreaming I was a butterfly, or whether I am now a butterfly dreaming I am a man. Chuangzhou, 396 to 289 BC. The bottom line: be sure to take any medications prescribed. The term clinical depression is used to categorize any form of depression where symptoms are severe and lasting enough to require treatment. The general advice and guidance in this book is believed to be suitable for those suffering from any depressive disorder, however mild or severe the symptoms. There are, however, some forms of depression that exceed the scope of this book, and those afflicted will require specialist medical intervention. Brief descriptions of these conditions follow. Melancholic depression is a severe form of clinical depression in which the patient has lost virtually all interest in the activities of life and does not respond positively, even temporarily, when something good happens. Quite simply, the patient has lost the ability to experience pleasure. By contrast, most people with severe clinical depression can usually be cheered up by good news, albeit temporarily. Manic depressive psychosis is a condition that takes the form of alternating periods of extreme melancholia and equally extreme periods of elation and excitement. A more technical term used to describe some patients who typify many aspects of this diverse and complex category is bipolar affective disorder. The manic element of the disorder is an abnormal exaggeration of the feelings of elation and excitement that we all experience from time to time. Some notable writers, artists and composers are believed to have suffered from this condition, including Ernest Hemingway, Charles Dickens, Virginia Woolf, Mark Twain, Beethoven, Van Gogh, and Mahler. When someone is experiencing a manic episode for the first time, the person concerned may not realize that there is anything abnormal in his or her behavior. It is often a family member, a friend or colleague who is the first to notice that something is not quite right. Atypical depression, which usually starts in adolescence and can be persistent rather than periodic, turns the typical symptoms of depression upside down. While people with most types of depression have a tendency to sleep and eat less than normal, patients with this kind of depression tend to oversleep, overeat, and gain weight rapidly. They can be very sensitive to rejection, particularly romantic rejection. Schizophrenia is a serious mental illness that affects 1% of the global population. There is abundant scientific evidence, though as yet no conclusive proof, to suggest that faulty genes may contribute to the onset of the illness. The illness generally becomes apparent in the sufferer's late teens or early 20s, although it can be middle age or even later before symptoms become apparent. Patients are usually advised, because of the risk of repeated episodes, to continue taking medication for many years, perhaps for the rest of their lives. Sadly, schizophrenia causes tremendous difficulty and distress for the afflicted and their families. Not only do sufferers have to contend with the likelihood of hallucinations, delusions, and interruptions to their train of thought, they also have to live with the image of a deranged killer as portrayed in so many films and TV programs. A representation which is far from typical. One point concerning depression of any type should be noted above all others. No less in authority than the Oxford Companion to the Mind advises, all persons suffering from depression should be adequately assessed for the risk of suicide. Relatives and some physicians sometimes hesitate to inquire directly about suicidal thoughts, lest such questions prompt the actions they are most anxious to prevent. The evidence is that most depressed patients answer truthfully to inquiries of this kind, and may even be relieved by the opportunity to discuss their innermost feelings of despair and dread of the future.